research takes time. The federal government can provide resources to accomplish major goals. The Human Genome Project is an example of a complex goal attained through the sustained harnessing of major talents by the National Institutes of Health, NIH. Key aspects of this project are the continuous sponsorship by NIH to fund dedicated scientists and the specialized resources needed to complete the project. These are the characteristics of the major scientific accomplishments of this century. Scientists need sustained funding to accomplish major goals. Research scientists require sustained funding to complete complex studies. In order to accomplish significant research, there must be a well-organized, well-planned approach. Haphazard, chance experiences do not lead to the major scientific investigations. Decreased funding results leads to the inability of scientists to complete research that takes years to finish. The various components of NIH are crucial to advance the diagnosis and treatment of the ills that affect men. And this is conducted by the sustained recruiting of patients around the country, so that studies are conducted that could be done nowhere else. The extramural program at NIH funds the research conducted at Hopkins and other major research universities around the world. Through the R01 mechanism, NIH provides investigators funding to have sustained research for 5 years. By having continuous grants, researchers are able to continue the funding for decades. This has resulted in the major advances in cancer and other diseases that we have experienced. Additionally, there continue to be major studies going on currently funded by NIH. Decreasing in the funding of NIH will lead to the cessation of long-term studies. Investigators will be discouraged to grow. This will cause talented researchers to take positions in other fields. We must stop the drain of scientists from research centers conducting groundbreaking investigations to conduct research to diagnose, treat, prevent the disorders that afflict mankind. The proposals in Congress to slash the funding of NIH by 20% or more would be detrimental to research programs to relieve the afflictions of mankind for the disorders that kill us. Congress must continue to increase funding to NIH in order to generate the advances that are just about to occur. For this reason, I urge you to contact your congressmen, your senators, to tell them that they must increase the funding for NIH.